Okay. All right. Welcome everybody. This is Therapy Thursday. It is December 17th, 2020. My name is Evan Adler. I am a physical therapist here at UNC Therapy Services based at the Northwest Cary Wellness Center. And Therapy Thursday is a program brought to you by UNC Therapy Services and the Community Engagement Committee. So we're very happy to bring you this installment of Therapy Thursday, and I've become the default MC of this program here. And today's my turn. So today I'll be doing a talk, and our topic is keeping your foot and ankle injury-free. It's no small feat. I'm big on puns, so look for them. Anyhow, so as I go through here, if you guys have any questions, please do put them in the chat. If it's particularly urgent, you can jump in, but I'll be monitoring the chat as I go through, and I'll leave time at the end for questions. All right, so with that, I think we are going to chug along here. So, keeping your foot and ankle injury-free. Let me give you a little introduction to me. Again, my name is Evan Adler. I'm a physical therapist. I'm the clinic coordinator here. And I'm a board-certified orthopedic specialist, Graston Technique certified, which is a form of instrument-assisted soft tissue mobilization, dry needling certified. Originally from New York, but I've been in North Carolina since 2008, so I'm enjoying not having all that snow right now, even though we have the chance for a white Christmas this year down here, which is pretty unique. I am a runner and I'm a cyclist, so this is of particular interest to me. I'm also a music enthusiast and a proud husband, dad of my two boys you can see there, 5 and 1. And we have a dog and a couple of bunnies. So lots going on at our place. Let's see. So as we go through here, so those are our objectives for today. We're going to talk a little bit about injuries, the kinetic chain, some anatomy of the foot and ankle, talk about some risk factors, some common injuries, and then ways to prevent them. So this is primarily directed at runners, but also very applicable to just your walkers out there as well. 60 to 80% of runners experience some level of injury every year. I usually, when I talk to groups, I have them raise their hands, and you'll see every hand go up for having some sort of injury in the past few years. Most injuries for runners are musculoskeletal overuse injuries, that cumulative overload to the lower extremities, step after step, mile after mile, just takes its toll. And 70 to 80% of running injuries occur from the waist down. And that makes a lot of sense because we're going to talk about that kinetic chain and how hitting the ground is going to send that ground reaction force right up through the body. So you're going to experience these more overuse injuries working their way from the bottom up due to all that impact. Your knee accounts for about 25% of all injuries. And then when you combine the foot and ankle, it actually accounts for about 31% of all injuries, all running injuries. So again, you're hitting the ground and the ground is hitting you back. That's an important piece of the puzzle. So let's talk about that kinetic chain. Lao Tzu said, a journey of 1,000 miles begins with a single step. Well, with running, even that first single step of 1,000 miles can lead to great injury if we aren't utilizing this kinetic chain properly. Okay, so with running, it's 1,000 steps per mile per foot. Okay, that is a lot of steps to be going through. So making sure that we have good running form and good training habits is going to be very important to make sure that we're not overusing what we have available to us, and especially when we're talking about this kinetic chain. So when I talk about the kinetic chain, it's that everything in the body is really connected. Okay, when we talk about it from the ground up, things that happen from hitting the ground is going to send those shock waves just all the way up the body. And do you have the right balance of stability and mobility? So we're always on this kind of scale between stability and mobility, right? Each one of the joints as we start to cross it should have more of one of these elements. So when we talk about the foot, the foot, it acts as a stable, has this more stability component to it because it acts as a rigid lever. And we're going to talk about that a little bit more in a moment. But it has this kind of spring-loaded movement that you're going to load it up and kind of push off of that foot. So you need to have that stability available. You move up a little bit and you get into the ankle. Now the ankle is a more mobile joint. It's a multiplanar movement, right? So not only does the ankle kind of point and flex like this, but also goes in and out, and there's a lot of movement that goes through there. So you need to be able to tackle the terrain on which you're running, and therefore the ankle needs to be a little more mobile, right? But you have to have that balance of the mobility and the stability, right? So I get a lot of people who come in here who have an overabundance of mobility, right? These hypermobile people, super stretchy, super mobile. And I always tell them, with great mobility comes great responsibility, because you still have to have the strength to control that mobility. And then just briefly going up the chain, you have the knee, which acts as a hinge joint, so it needs to be good and stable. The hip is a mobile joint, right? That ball and socket movement. Lumbar spine should be good and steady, while the thoracic spine should be nice and mobile so that you can rotate, get that kind of gyroscopic motion as you're running. All right. So some basic anatomy. The foot and ankle is an extremely complex system. 28 bones, 33 joints, 112 ligaments, 13 extrinsic muscles, 21 intrinsic muscles. I mean, there's a lot going on in there. So let's just take a little bit of time to go through each one of these bones and joints. All right, so stay with me now. Okay, I'm just kidding. I'm not going to do that to you. So let's talk about some basics about the joint here. Okay, so first you have your ankle. Okay, it's your talocrural joint. Okay, it's a mortise joint. You have the two bones of what's considered your lower leg there, right? So your tibia and your fibula. Okay, your tibia is running straight down the front of your shin. The fibula is kind of on the side there. It's a long, not really a weight-bearing or very little weight-bearing structure. Those come down to form the 2 points on either side of your ankle. And then you have the talus bone, which sits right above your heel bone that goes up into that joint. All right, kind of creating that movement there. In the rear foot, you have your heel, your calcaneus. Okay, and as it comes up against that talus bone to form your subtalar joint, and that's where a lot of your pronation comes. And we're going to talk about that as well, because that's usually a buzzword, usually a buzzkill for a lot of runners, where they're told that they pronate, and that's a bad thing. And we'll talk about that. Your midfoot, moving a little bit up towards the toes, and those are kind of your tarsal bones, and that's what maintains those arches in your foot. Okay, your forefoot's where your metatarsals and your phalanges, or the digits, the toes, and these are extremely important for propulsion. Okay, this is how it interacts with the ground to push you forward. Okay, all right, let's move on. All right. So the function of the foot and ankle. So we talked about the foot, how it's a rigid structure for weight bearing. Okay. However, it needs to be a flexible structure so that when you're on an uneven terrain, you can adapt to it without it just pushing you off your game and knocking you off the mountain. Okay. It's going to support your body weight, provide balance, and act as a shock absorber. Okay, so we talked about, I mentioned before, right? You get that kind of spring-loaded effect. Okay, so when we're running, we get about 3 to 4 times our body weight every time we hit the ground with that single leg, that single foot, adapting, accepting that weight, and then transferring that energy to push off and launch forward. So that shock absorption is pretty important. Okay, anybody remember Risk? Is that a game nobody plays anymore? So here are some risk factors for foot and ankle injuries. You have these extrinsic factors, okay? So things that are not inherently within us. Training errors, okay? I see that a lot. Folks go out, they go too much, too fast. They increase their amount of training miles, and it's not proportional to what their body can actually handle at that time. Improper running surface. So, you may be doing a lot of running on the road or running on sidewalks or doing some trail running. Okay. So you get a lot of, there's a lot of variety in what you're running on. And if you do something that you're not used to, well, then you need to take care in doing that as you change up. One of my favorite anecdotes about this is that I had a runner who did the San Diego Rock and Roll Marathon. And after the marathon, she came to me and she said, man, my ankles are just absolutely killing me. My knee's killing me. My hip is killing me, all on the one side. And, what we traced it back to is that the whole marathon is run on the roads. And she was running more towards the sidewalk instead of towards the yellow line down the middle. And she ended up getting injured because the roads are cantered in such a way that she was always had one hip a little higher than the other for 26 miles in a row, which caused her the whole thing to be thrown off. Worn shoes, wet shoes, your conditions matter. How long you've been using your shoes, it all kind of plays into it. Okay, your intrinsic factors. So your flexibility, okay? We're going to talk about this a little bit more, but making sure that your muscles are of the right length or good length. Prior injuries. So if you've had a hip injury before, if it hasn't been properly addressed, you may end up with a knee injury. You may end up with a foot or ankle injury. It happens all the time. Age. So over the age of 50, we start to see a lot more injuries, and particularly in females. Now, I'm not biasing this myself. We just see it from the literature that your risk factors for injury increase at that point, particularly for women. Malalignment. So just your anatomy. Do you have cavus feet? So do you have a really high arch? Do you have pes planus where you have no arch at all? LLD is a leg length discrepancy. Do you have one leg that's significantly longer than the other? That can play a big difference. So most predictive factors we see in injuries are those training miles. If you're increasing way too quickly, then you are at risk for injury. And then if you have a history of a previous injury, you are at greater risk for a new injury. So I guess the lesson here is don't get old and don't get injured ever. So here are top foot and ankle injuries that we see with our runners. So the first is Achilles tendinitis. We usually find that comes with a lack of dorsiflexion. So dorsiflexion is where you're bringing your ankle kind of toes up towards you as opposed to pointing your toes down and away, which is plantar flexion. And it's usually indicative of tight calves. So you end up kind of running on your toes a little bit, less on the heels, and you get a really good pull on that Achilles tendon. Plantar fasciitis. This is just the bane of every runner's existence. Usually, again, a result of tight calves, hamstrings, and even a stiff great toe. So great toe is what we call our big toe. That stiffness across there can cause a lot of tightness and extra pull across that band of connective tissue on the bottom of your foot. Inversion ankle sprains. So this is a traumatic injury of the ligament that's on the outside of the foot. And if you can kind of see my picture in the window there for a moment. So I have a foot here. So usually you're so here's your dorsiflexion and your plantar flexion. And your inversion ankle sprain is when you kind of rotate into the inside, kind of down like this. And you end up straining the ligament on the outside of your ankle. There are different degrees of those sprains. We're going to talk about those. So we're going to get into those three today, but a couple other ones that we see a lot are anterior ankle impingement. So it's the front of the ankle. You can feel like a kind of a tightness, a pinching sensation in the front of the ankle. And then that hallux valgus, or a bunion. So that's where your big toe kind of at the ball of the foot starts to kind of pop out to the side, and then kind of the toe ends up going back up in, so make a kind of a big triangle there. Again, usually because of tightness, can be because of lack of hip external rotation and an increased medial force. So the inside so you're putting more force through the middle of your foot towards the ball of the foot, and you need more support there. So the body adapts. All right, so an overview of Achilles tendinitis, most common tendon pathology in the body. Okay, 10% of all running injuries, and the Achilles tendon helps to provide power during a push-off. You get this strong eccentric contraction with running uphill, with uphill running, sprinting, and with forefoot running, right? So an eccentric contraction is, right, so the muscle goes in two directions, right? You have this concentric contraction where the muscle contracts and becomes shorter, causing a joint to move. An eccentric load is the opposite. It's under load, the muscle will kind of slowly release as it comes out. Okay, and that's a much stronger force through that muscle. Okay. Now, the more common in older runners, and what we end up seeing is this inflammation of the tendon at or near the insertion down on the calcaneus, or that heel bone. So the back of the heel, you get that kind of burning sensation, often a result of these tight calves and overuse of the calves during this push-off, right? Because as you're contracting your calves concentrically to push off, pushing through that foot, through that big toe, that's when the calves contract and you get that strain there. There we go. All right, so moving on here. There we go. Okay. So symptoms, having severe pain the day after exercising. So you may not have it right during, but you may have that inflammation from afterwards. You may get this thickening of the tendon. So the tendon kind of comes down in this line behind your heel, and you may find that it starts to get a little bit wider, particularly at the point of inflammation, right? It's that tendon really kind of thickening up, and there's some scarring going on there as well. Realigning kind of that matrix of that tissue. Pain and stiffness along the Achilles tendon in the morning. Most people don't realize that we all sleep with our toes pointed in this plantar flex position, which shortens the calf and the Achilles tendon. So that when you wake up in the morning and you step on the ground, you get this big pull on those tissues right away. Pain along the tendon or the back of the heel that worsens with activity. Okay, so initially it may not be too bad as it starts to loosen up a little bit, but then because it's an already inflamed, angry tissue, it just starts to rub and everything starts to get angry again. Bone spurs will sometimes occur, only with insertional tendinitis. So if it's really, really all the way down at the heel, and that pulling on the heel because of Wolff's law will actually create bone to form at that place. So you can get some bone spurs that will occur. And you also may find that you have swelling that's present all the time. It gets worse throughout the day with activity. Okay, conservative treatment. Now, I'm always a big proponent of PT, being a PT myself. But even before we start getting there, rest is important. Let that inflammation kind of calm down. NSAID, so over-the-counter, non-steroidal anti-inflammatories. Taking your pain relievers that are over-the-counter. Ones that have found to not be offensive to your GI system are okay. Using some heel lifts temporarily. So when you're running, having a lift underneath your heel so that you're in a little more of a plantar flex position, which decreases the amount of stretch and strain on your Achilles. And then we get to what we do: manual therapy and therapeutic exercise. And not mutually exclusive, but making sure that they're combined together. So doing some of the things that we do here, the soft tissue mobilization, using that Graston technique that I mentioned before, dry needling to release some of the trigger points that are within the gastroc and soleus complex. And then following it up with exercise, getting some stretching, getting some targeted exercise to address any deficiencies in the chain, in the hips, in the core. The intrinsics in the foot as well. Okay, that LQ stability exercise, so lower quarter, your hip, your quad, your hamstring, making sure everything is good and firing there. Now, other options there, to prevent some of this night pain or night splints, which have some good evidence behind them. People, for the plantar fasciitis as well, recommend like a Strasbourg sock, which is a sock with a strap on it that kind of pulls you into a little bit of dorsiflexion to prevent that tightening of the calf overnight. And then over-the-counter or custom-made orthotics, again, to help support the arch, lift the heel up a little bit, and relieve some of the tension on the heel, on the Achilles. All right, plantar fasciitis. Got that itis. I hear people come in with this all the time, 5 to 10% of all running injuries, and it can last a long time, okay? Over 12 months, can go up to 2 years of symptoms with this. The plantar fascia is a non-elastic, fibrous connective tissue, okay? So everything around it kind of needs to be nice and loose and controlled, but the plantar fascia itself is not really going to stretch all that much. And it runs from all the way on your heel to all the way past the ball of your foot, up past that onto the toes. So it's a long, long piece of connective tissue there. It helps to form this rigid arch, transferring energy from loading to pushing off the foot, right? So there's that rigid lever that we need. It helps to support that to help us push off. Symptoms, you're going to get this heel pain, right, on the bottom of your heel. So, on the plantar surface on the bottom. And it's going to be a little more towards the medial side than the lateral, a little more towards the inside than the outside. That's the main anatomical connection for the plantar fascia. It's going to be worse in the morning with your first steps or after prolonged sitting. Again, sleeping all night with your foot pointed. You're going to get that contraction of it, and you're going to step on it first thing in the morning, and all your body weight's going to be on it. And that's one of the big complaints of that pain. You're going to get pain at the beginning of the run, okay, with those first steps, and then it's going to feel okay. It's going to kind of loosen up. The muscles are going to get a little loose, the intrinsic muscles of the foot, and then it's going to come back in spades later on. Okay, walking barefoot without any of that protection on that heel is also going to be one of the symptoms that we get. And you can get some thickening of that plantar fascia as well, just like the Achilles tendon. So conservative treatment is successful 80 to 90% of the time. Okay, we do have some patients who come in after surgery to release the plantar fascia, but usually we can get it under control here. Again, rest, NSAIDs, icing, going easy on the frozen water bottle. That's a kind of a home remedy that I hear a lot. Take a water bottle, fill it up with water, put it in the freezer lying outside, and then using it to roll like a foam roller on the bottom of your foot, except it's giving you ice and compression at the same time. Now, I'd go easy on that because too much compression on this tissue is only going to help to continue to feed that inflammation, even if you are icing it at the same time. A heel cup with a cutout so that that heel piece kind of sticks into that cup, so that you're not putting direct pressure on the heel. A little bit of arch support to make sure that the plantar fascia is not getting overly stretched. Making sure we're stretching our calves, our hamstrings, and the great toe, making sure we have enough extension of that big toe, because like we said, that plantar fascia goes all the way past the big toe and connects past there. So we want to make sure everything is good and loose there. Strengthening the foot intrinsics, those small muscles within the foot that help us kind of keep that arch, form that arch, and allow us to move the foot kind of independently and not just in a reactionary way. Strengthening the hip stabilizers as well. And then there's mixed research out there on using orthotics for the use of plantar fasciitis. So can be done, but should be used taken with a grain of salt. Okay. Let's talk about an inversion ankle sprain. So this is a traumatic injury. This is when we roll our ankle. The number one predictor of whether you're going to have an inversion ankle sprain is if you've rolled your ankle before. Okay, once you've rolled it once, you have about an 85. Well, it only comes back to about 85% of what it was before. So that means you're going to have an increased likelihood of experiencing this kind of injury just because of where we are. Just because of having that previous injury and coming back. So typically a result of rough terrain, weak everters of the foot, and poor balance overall. So if we have this poor proprioception when we're running, not knowing kind of where we are in space, your foot has to do all this extra adjustment to the terrain as you hit it, and that can lead to some trouble. So can increase the risk with some weak lateral hip stabilizers as well. So leading to this kind of crossover scissoring running gait where you're running really kind of one foot in front of the other like this. And when you do that, you kind of land with your foot kind of turned like this a little bit, which can increase the risk of rolling onto it. All right. So overall prevention strategies. So we want to maintain good length and a strength balance of your posterior chain, right? So that's running down your backside, your glutes, so that's your butt muscles, right? To your hamstrings, to your calves, all the way down to your plantar fascia and the intrinsic muscles of your foot. Making sure you have good length of those muscles, but also having good strength along with them too, right? Getting on that scale and that balance. Maintaining good joint mobility, so making sure that your hips and your ankles have enough room to move, right? These need to be your mobile segments. So stiff hips, stiff ankles can also lead to injuries. Watching your weight. We are now, how many months into this pandemic, and I've heard of the COVID-19 pounds. People are just putting on tons of weight now, and that, from not exercising and being so sedentary. And that is, every pound that we put on translates into about 3 pounds of pressure on your joints as you're walking or running. So a little bit of weight increase can have a lot of effect. Okay, so in going in reverse, a little bit of weight loss can really, really, really help minimize risk for injury. Proper and supportive footwear. Running and for work, making sure you're wearing something that's good and supportive for your feet, fashion and function. I always like to give a shout out to the local people. So, my friends at Bull City Running Company are fantastic here in Durham. Fleet Feet's another great company around here, and all over the place. So go get fit for your shoes. Make sure you're in the right shoes that can help you out. Smart training. Avoid those sharp increases in mileage and weight-bearing activities. All right, so I'm going to go through a few of my favorite things here. spend just a couple minutes here, and then we'll open up for any questions. So I have a few pictures there. So that first one is stretching your gastroc, or the big calf muscle. You'll see that his back leg is straight, okay, because you're stretching that back leg. And the reason the knee is straight is because the gastroc does not cross, the gastroc does cross the knee. So you want to make sure that knee is straight. If you go ahead and bend the knee and bring your weight a little forward, you're now stretching the soleus, which is the other big muscle in your calf complex. Next one is just a simple hamstring stretch. And the last one is a stretch for your glutes, your glute max, making sure that we're getting nice, good stretches in there, all on that posterior chain. Now, if anybody would like to get a copy of these stretches, if you want to send me your email in the chat section there, I'd be happy to spread these around. I'm also going to have this whole thing posted up on YouTube on our channel for UNC Therapy Thursday. You can go ahead and search YouTube for that, and I'll go ahead and post a link on our Facebook page as well. So strengthening, here's a few of my favorite strengthening exercises. Single leg bridge, really get those glutes activated, and you're keeping your hips nice and level as you go through. Doing a squat with a band around your knees, making sure that you're not overly, pulling out or dropping your knees together will really help those lateral hip stabilizers. Again, that hip hike there, that next one is letting your leg kind of drop down and using that stance side leg to pick that hip back up. So you kind of got this teetering motion going on here, all controlled by the stabilizing side. Next, you got that running man motion there. So you're standing on one leg and you're bringing your arms and your legs kind of back and forth, kind of going through that running motion, but all while standing on one leg. Okay, last set here is that we have intrinsics and proprioception. So working these intrinsics of the foot. I love these towel scrunches, just kind of grabbing these towel and pulling it towards you, working those muscles within the foot. Then you have this foot doming, which is actually an incredibly difficult exercise. Kind of get that dome of the foot to kind of arch up and down and up and down. Very, very effective. And then you have these proprioception exercises. So you have single leg balance on a BOSU or an unstable surface. You want to make it harder, go ahead and close your eyes. You'll be amazed on how difficult it becomes. And then some single leg clock reaches. So just standing in one place and reaching that leg out to different places that will kind of take your reach outside of your base of support and will really kind of challenge you. So if there are any questions, please feel free to put them in the chat, or there's only a few of us here. So if you do have any questions you want to speak up, that would be fine as well. I'm just putting up here, they're my boys, and there's one of my bunnies. I have two of them that look exactly alike. So I felt the need to only put one of them because I can't tell them apart anyway. My contact information is there along with my email and our phone number here. If you have any questions about a specific injury that I could potentially help with, be happy to help you out over email if I can. If I think it's something you need to be seen for, I'll let you know. Other than that, I invite you to join our Facebook group, UNC Therapy Services, where you'll find out about more presentations. And again, this will be posted up on our YouTube page as well. Our next therapy Thursday will be in 3 weeks. We'll return back because we do it on the first and third Thursdays of the month. So January 7th, and I don't remember what the topic is. So check out our Facebook page to stay informed on that. Okay, so with all that, I thank everybody. I'm going to turn over. I'm going to look at the questions now. So can you expand on your explanation of food effect on the hip? Food effect on the hip. I'm not entirely entirely sure what we're referring to with that. The person asked me privately, so if you want to expand on that question, I'll be happy to answer a little bit more. I don't want to call you out. Are there any other questions in the meantime? Foot. That makes a lot more sense. Foot effect on the hip. Thank you. Okay, so foot effect on the hip, absolutely. So it's all part of this kinetic chain that we were talking about, right? So if we have this instability at the foot, so let's work our way up the chain. Instability at the foot. If you come down in an odd way where you're kind of crossing over and the foot is kind of in this weird type of position, if you don't have enough strength to kind of right yourself, now that would be like an isolated footstep, a misstep, right? If your weakness in the foot can send shock waves kind of all the way up, right? It can kind of cause your knee, instead of just doing this nice hinge thing, right, to do this kind of hinge and opening thing. I'm going to, let's see, what am I going to do here? I'm going to stop sharing my, I'm going to stop sharing that for a moment so you can see me a little bit better. Okay, so if you have this motion at your knee, which should normally just do this, and it does one of these jobs where it kind of goes like this and like this, or like this and like this, okay? Well, now you got to go up the chain as well. Aside from possible injury to the knee, now the hip, which is this nice ball and socket joint trying to hold steady around here, right? You may have to go all the way to the inside like this, which may cause a lot of pressure going out to the outside of the hip. Or if you get this kind of over rotation towards the inside because it's accommodating for that knee dropping inward or taking a funny step out, you can get a lot of just motion in the hip that is not, it's not very controlled, okay? So let's reverse it, which is more likely the situation where your hips are not as strong as they should be. And therefore, that's the reason why your leg is kind of crossing over this way, or we're running with it turned out so that your toes turn out like this when you run, which means that you're going to start running kind of going this way on the foot as opposed to this way on the foot. And when that happens, you're going to cause some more of these overuse injuries, leading towards, that arch starting to fall a lot. You can get those plantar fascia issues. You can get that development of that hallux valgus, that bunion formation, because you're putting a lot more pressure through the inside of the foot. So making sure that we're as kind of upright as we can be, as steady we can be on one leg at a time, can only serve to help the entire chain and help protect the foot. So I hope I answered your question there. Any other questions for me? All right. Okay. Well, I thank everybody for coming to Therapy Thursday today. It was a pleasure having you all here, and hopefully we'll see you again at the next session. I'll hang out for a moment while everybody's off in case anybody has any other questions that they want to ask privately in the chat. So thank you very much, and have a great happy holidays. Hey, John, if you can hear me, you and I are the only one on here right now.
Yeah. Can you hear me?
Yes, I can. Oh, looks like.
Okay. How you doing?
I'm good.
I'm in
How are you?
Southern California.
Oh, wow. How did you find out about this today?
Our daughter works at UNC, Julie Seiler.
Okay,
She
great.
works at UNC and she recommended you. So it's been a great presentation. Thank you.
Fantastic. Well, thank you for hopping on here. I did get your wait, hold on one second for me.
I sent you my